People who are sexually active and want to avoid pregnancy should be aware of their options when it comes to birth control. There are many types of contraceptions available to help avoid pregnancy. However, the only completely reliable method for avoiding pregnancy is abstaining from sex. Hi, I am Firdaus Mudassir and welcome to my channel Women in Childcare. And today we're discussing the top 10 ways to prevent or avoid pregnancy. Number 1, male condoms. Male and female condoms are the only types of contraception that protect against sexually transmitted infections, which is STIs. When used correctly, male condoms are more than 80% effective against pregnancy, according to the experts. Number 2, female condoms. Female condoms are also available without a prescription. They can be used instead of a male condom, but should never be used with one. According to the experts, female condoms are about 79% effective for contraception. Many drugstores now sell female condoms, but if local stores do not stock them, they are available online. Number 3, cervical cap. A cervical cap is a soft silicone cup that is placed deep inside the vagina. It covers the cervix to stop sperm from reaching an egg. This effectiveness of the cervical cap varies according to the sources, but experts estimate that its effectiveness ranges from about 70 to 85%. It does not protect against STIs. Cervical caps are available in drugstores and online. Number 4, contraceptive pills. Birth control pills are one of the most commonly used methods of contraception worldwide. There are various brands of pills available, and according to the experts, they are over 99% effective if taken as prescribed. However, with typical use, they are approximately 95% effective. There are two forms of the pill. Number 1, the combined pill, which contains estrogen and progestin. These should be taken daily as per the instructions. The pill pack often contains some pills that are free of hormones. When taking these pills, a person will have a monthly period. Number 2, the mini pill, which contains only progestin. A person must take this pill at the same time every day without a break. Someone taking the mini pill will not necessarily have a scheduled period. Number 5, injection. The contraceptive shot is usually given by a doctor every 12 weeks. According to the experts, when used correctly and assuming that a person gets their shot on time, it is over 90% effective at preventing pregnancy. According to experts, it may take up 10 months or sometimes longer for fertility to return to normal after a person stops getting the contraceptive shot. Number 6, vaginal ring. According to the experts, the birth control ring known as the Nova ring is over 99% effective when used correctly, but is typically less than 95% effective due to human error. This small plastic ring is placed in the vagina for 3 weeks. It releases hormones into the body to prevent pregnancy. The ring must be removed for 7 days to allow for a menstrual period before inserting a new ring. Number 7, intrauterine devices. IUDs. They are long-term contraceptive devices. The experts state that they are over 99% effective at preventing pregnancy because there is little room for human error there. However, they do not protect against STIs. An IUD is a small device that a doctor inserts into the uterus. There are two types of IUDs. Number 1, hormonal. Once fitted, an IUD lasts for at least 5 years before it needs replacing. IUDs do not completely stop ovulation, but acts as contraception by thickening the cervical mucus to prevent sperms entering the uterus, as well as other hormonal changes. And the second type of IUD is copper-based. This hormone-free IUD is covered in copper wire, which destroys sperm trying to enter the uterus. One IUD can prevent pregnancy for approximately 10 years. Adverse reactions include spotting between periods, irregular periods, and menstrual cramps. Tip number 8, implants. Implants are another form of hormonal birth control. A nurse or a doctor inserts a matchstick-sized rod into a person's arm to protect against pregnancy. Implants work by releasing the hormone progestin into the body, which prevents ovulation. The experts estimate that implants are also greater than 99% effective for contraception. Implants must be replaced about every 3 years. Number 9. Emergency contraception. In the case of unprotected sex or failed birth control, such as broken condom or a failure to take the contraceptive pill, it is possible to use emergency contraception to reduce the risk of pregnancy. Emergency contraception should not be used in place of regular birth control methods. There are two forms of emergency contraception. Number 1, emergency contraceptive pill. People must take a hormonal pill within 3 days of intercourse. The sooner a person takes it, the more effective it is. So a person should take it as soon as possible after having sex. The pill usually contains the chemical levonorgestrel. These pills are available from a doctor or a drugstore. And the second type of emergency contraception is copper IUD. The copper IUD can be inserted up to 5 days after sex to prevent pregnancy. According to the experts, it is more than 99.9% effective when used in this time frame. And with this, we come to the last point, which is sterilization. Both women and men can undergo procedures to reduce their fertility permanently. The experts state that these procedures are typically over 99% effective at preventing pregnancy, but they do not protect against STIs. Men can get a vasectomy, which involves snipping the tubes that carry sperms. It is a minor procedure that does not require hospitalization. A vasectomy reversal is possible in some cases. However, fertility after the reversal is not always fully restored. Women can have a sterilization process known as tubal ligation. It involves clamping or sealing of fallopian tubes. The effects are usually permanent. In rare cases, tubes can reconnect and result in pregnancy. Now, let's have a look at the natural ways of preventing pregnancy. There are some methods of preventing pregnancy which go hand in hand with the human body and medical science. Some of them are: number 1, having sex during your safe period. This method provides an added layer of precaution if you already have some kind of protection in place. You can avoid the ovulation days, which usually occurs 2 weeks before the period. A good way to go about this is to consult a fertility expert to track your ovulation days and schedule your intercourse accordingly. Number 2, practice the start-stop method. The male partner can take care not to ejaculate inside his partner. This method requires practice, and there's a risk that the sperm might somehow enter the vagina. Therefore, it's better to do this along with other proven contraceptive methods. Number 3, track your basal body temperature. Once a period ends, you can start tracking your basal body temperature. When ovulation begins, the temperature starts rising and peaks on the day of ovulation. You can avoid conception if you avoid sex during this period. And number 4, look out for cervical discharge. A woman's body produces a transparent jelly-like discharge in the days leading up to ovulation. Abstaining from sex during this period can prevent ovulation. So folks, that's it from me in this video. If you have liked this video and the other videos on this channel, make sure you hit the subscribe button and also click the notification bell icon. You can also follow me on other social media platforms like Instagram, Facebook, and LinkedIn. In case of any doubt, query, or inquiry, make sure you write to us on the email ID given in the description box. See you in the next video. Thank you so much.